Welcome to week 2 of the Kid and Parent Show. I am Asha. Your body is most fertile either towards the end of this week or early next week. In this week's show, we will discuss ovulation and learn about signs to identify ovulation. We will also talk about the ideal pre-pregnancy weight. Let us have a look at the changes taking place in the mother this week. Changes taking place in mother. This week is the beginning of your wonderful journey of motherhood. When you're going about your day-to-day life, a little tiny thought starts its life inside you. Most of you may not feel anything, but some of you may experience very mild cramp-like symptoms due to hormonal changes during ovulation. Question of the week. Fertile period is the window of time during which a woman can conceive each month. It depends on her ovulation date. Ovulation usually occurs about 2 weeks after the menstrual period. The women's 5-day fertile period starts from 2 days before ovulation and lasts until 2 days after ovulation. If you have unprotected sex during your fertile period, then you have a chance of getting pregnant. What is ovulation? Ovulation is the process of an egg being released from a woman's ovaries. This usually occurs about 2 weeks after your last period. The exact date of ovulation can vary from one woman to another based on her menstrual cycle. You can identify your ovulation date if you pay attention to the signals from your body. Here are some common signs that can indicate that you're ovulating. Indicators of ovulation. Right before ovulation, you may feel cramps in the lower abdomen. This pain is called mitral MERS. You may also notice a very small rise in body temperature and tender press. The vaginal discharge becomes thinner so that the sperm can swim easily. Did you know? Only 25% of couples actively trying to conceive will experience pregnancy within the woman's first cycle. However, 90% of couples will achieve pregnancy within the first 12 months of actively trying. Ideal pre-pregnancy weight. You should have optimal scores on the weighing scale if you're planning for a baby. A mother has to provide for the baby during pregnancy. This can place large demands on the woman's body. So, she should have a healthy body and not be frail. On the other hand, obesity can be a contributing factor to diseases like diabetes, hypertension, heart disease, etc., leading to a difficult pregnancy. It is also not advisable to lose weight during pregnancy. So, it is very important to have an ideal body mass index before you conceive. Body mass index, also known as BMI. BMI is calculated as weight in kilos divided by height in meters squared. For example, if your weight is 60 kilos and your height is 1.6 meters, your BMI is calculated as 60 kilograms divided by 1.6 multiplied by 1.6 meters, which gives you the BMI of 23.44. To determine if your weight is optimal, use the Kid and Parent BMI calculator at www.kidandparent.in. BMI chart. BMI in the range of 18.5 to 24.9 is normal. BMI in the range of 25 to 29.9 is considered to be overweight. BMI in the range of 30 or greater is obese. Tip of the week. Following a regimen of healthy eating and regular exercises even before you conceive improves the chances of healthy and active pregnancy. Words of wisdom. Have a fertile and healthy week with this beautiful quote from George MacDonald. Where did you come from, baby dear? Out of the everywhere and into here.